What a great group we've got with us today. I want to welcome you to our movement disorder expert panel. We are so excited to host today's panel and offer you more opportunities to engage and interact with the panelists. So today's educational series will look a little bit different as we've opted to make this program a Zoom meeting. And so some housekeeping items for you to keep in mind. At the bottom of your screen, you're going to see some options that you have that will allow you to interact during this panel discussion. If you have a question or a comment, you can use the chat feature at the bottom of your screen. When you click on it, a small window will appear that gives you the option of messaging someone privately or in a group. And if it's privately, you can select that person there. The second thing is, if you're asking a question, make sure that you're not muted, and which you can manage on the bottom left-hand corner of the toolbar. You'll see that microphone with a slash, and you can unmute yourself there. And then if you prefer that we not see you, simply click the stop video, and don't be afraid, that won't stop you from viewing the program itself, but it will simply mean that others can't see you, and that is perfectly okay if that's what you're comfortable with. And then if you are having any troubles at all, any problems connecting or hearing or anything like that, please use the chat feature and privately message Leisha on the DAPS account. Now, I'd like to introduce our expert panelist that we are honored to have with us today. And so, first of all, let me introduce Dr. Chitnis. Dr. Chitnis is professor of neurology at UT Southwestern Medical Center in Dallas. She has been involved in the care of patients with movement disorders and in the education field for the past 19 years. She received her medical degree from Grant Medical College in Bombay, India. She completed her PhD in pharmacology and residency in neurology from Tulane University. And then she completed a fellowship in movement disorders from Louisiana State Medical Center in New Orleans, Louisiana. She serves as a fellowship director for the movement disorders programs and was associate program director for the neurology residency program at UT Southwestern from 2007 to 2017. She is medical director of the deep brain stimulation program for the movement disorders at UT Southwestern. Dr. Chitnis has written a couple of books, with the latest one being Deep Brain Stimulation, a Case-Based Approach. And then she's also authored several journal publications as well. Her philosophy towards patient care entails a comprehensive approach, including family members and all ancillary personnel involved in the care of patients, including physical and speech therapists, primary care doctors, and other specialists. Dr. Chitnis has been married for 23 years, has a 17-year-old daughter who is the apple of her eye, and she enjoys reading, music, movies, traveling, and as we learned before, some of you may have been able to join in with us, she also enjoys cooking. So she was offering a cooking video that we may take her up on at some point. So those are things that she enjoys and a little bit about her. And then there's Dr. Michael Braitsch, also known by many as Dr. Mike or simply as Mike. And good friend of DAPS, has been around for some time. He is a physical therapist. He's PT, DPT as well, who treats patients with Parkinson's and runs group programs that aim at impacting impairments associated with Parkinson's disease, drawing on his background as a champion martial artist, former fighter, strength and conditioning coach to world champions. He serves as an instructor in programs for DAPS classes and is studying the effects of non-contact boxing on Parkinson's disease. That is something Mike has done in the past. Mike, are you still doing that in partnership with UT Southwestern?
Had to unmute there. Our study, like many things, is currently on hold.
Okay.
It's tough to run it virtually, especially with the grad student involvement that we like to get from the PT school at UT Southwestern. But we've still got plenty of classes online. for anybody that wants to try, just like the many great DAPS classes that are out there.
All right. Thank you, Dr. Mike. I was reading your bio here and I came across that and I thought, how is that working during these days of COVID? So you've answered that question for me. Feel free to contact Dr. Braitsch at tribewellnessllc@gmail.com and learn more about the programs that he does. And I want to back up a bit and mention about Dr. Chitnis that she is also serving on our medical advisory board, as is Dr. Braitsch. And then Dr. Braitsch also serves as the liaison between the DAPS Board of Directors and the DAPS Medical Advisory Board. So we are both thrilled to have them with their expertise join the DAPS team in those ways. And then last but not least, we have Lauren Lanford, MS, PAS, PA-C, and she's a board certified physician assistant in the Department of Neurology Movement Disorders Clinic. She specializes in the treatment of movement disorders, including Parkinson's disease. She earned her undergraduate degree at the University of South Carolina and her Master's of Science and Physician Assistant Studies at South University in 2013. She has worked in neurology for the past 8 years with a special interest in the management of Parkinson's disease. She is involved in research, patient education, and development of the Duopa Clinic at UT Southwestern for management of advanced PD. She's a member of several professional organizations, including the American Academy of Physician Assistants, American Academy of Neurology, and the International Movement Disorder Society. And so we have quite the team today. And now I will turn it over to Leisha and the team, and we will get started.
Terrific, terrific. Well, again, thank you so much to our panelists. We're thrilled that you guys are here with us, and it's just really, really good to see everyone's face. We, of course, can't wait until the time comes and we can all see one another face to face, but until then, we'll do what we can. So we will go ahead and get started. We know that a lot of folks are either waiting to get their vaccine or they're scheduled to or have received it. So we really kind of wanted to start off with some questions around PD, COVID, and of course the vaccine. So we're going to start off with a question for Dr. Chitnis. And so our question is, are there any special considerations for people with PD regarding COVID and regarding the vaccine?
Here, sorry, just unmuted myself. Thank you. So, Parkinson's disease per se does not put anybody at a higher risk of developing COVID. But as we know that a lot of the patients that have Parkinson's disease are elderly, and age is certainly considered to be a risk factor. At the same time, as you get older, you also have other comorbidities, like people may have diabetes, they may have hypertension, some people may have immune disorders, and all of those comorbidities certainly put you at a higher risk for contracting the infection. So that's number one. And then the other part of your question was vaccine?
Right, and regarding the vaccine in terms of effects or side effects that people might be looking for, are there some different effects that folks might need to be aware of if they have PD and have received or are going to receive the vaccine?
So thank you. If they have Parkinson's disease only and they do not have any, especially immune disorders, I think they will have the exact same reactions as the rest of us without Parkinson's. So that's basically, I remember people talking about having a flu-like reaction, people talking about having a headache, just feeling really fatigued. I know arm pain, injection site arm pain is certainly a problem. I remember my own experience. I basically was just completely wiped out with the first dose for 2 days, the second dose for about, maybe a day and a half. But I think that those symptoms are very mild. They're not, you can certainly take Tylenol and they ride over. Within 4 days, I was okay. So I think if you're a patient with Parkinson's and it's your turn, to get the vaccine, then certainly you should get it. The only restrictions I can think about is people that basically have autoimmune disorders that take infusions. and so that might reduce your immunity. And so it's really important to talk to your doctor, whether it's an internist or whether it's a rheumatologist, to talk about how much time interval you need, between your last infusion and your time to get the vaccine, and then again, stage the time for the next infusion. So that's what I would pretty much say. But other than that, I think Parkinson's by itself, and I'll say one last thing, is, just trying to see whether there is any correlation between, Parkinson's disease and something related to the virus. And one of the etiologies, if you think about things that may cause Parkinson's, is inflammation. And so the virus basically also, acts by one of the similar mechanisms by causing the release of a lot of inflammatory markers, including cytokines. And we've heard a lot about the cytokine storm in patients with very severe COVID. But really, what I said is pretty much it. But I still think that each individual patient needs to talk to their primary care doctor or their neurologist, because then you would know what else is going on with them.
Makes a lot of sense. Yeah, that's very helpful. So I'm going to switch over to you, Lauren. And our original question, I think Dr. Chitnis kind of covered that, which is the risk of contracting COVID greater for someone with PD? And she covered that. Can you talk a little bit about any of your patients that you've seen that have PD and have had COVID, what that experience has been like for them, how they've recuperated, what's been helpful, et cetera?
Yeah, initially early on in the pandemic, we didn't have very many patients who had COVID, but in the past 6 months, that number has certainly increased over time. And everyone's experience, obviously, with COVID-19 is very, very different and variable and impacted by age, but sometimes that's not the only thing. I've had several patients who've done actually very well and recovered very well without any complications or needing to be hospitalized or having anything too serious going on. And those are even some patients with quite advanced Parkinson's disease or just advanced age. So I've been pleased with that. But any type of infection can worsen Parkinson's symptoms, tremor, more fatigue, sometimes hallucinations, those things like that. Even a urinary tract infection can cause those things. So we had dealt with some of those issues and symptoms transiently during the week or two they were sick, but they all have resolved and gone back to their baseline that they were before. That's not going to be everyone's experience, but it hasn't impacted Parkinson's long term that I've noticed. And Dr. Chitnis can add to that if she's seen anything different in any of her patients, but they've done actually very well. The key is they had to keep their medications, make sure they had all their medications refilled while they were quarantined in the house, or if they had to go to the hospital, making sure they had all their medications refilled and with them so that they didn't run into any issues with disrupting their Parkinson's medication regimen.
Well, that's really encouraging. And I think for all of us to hear that, we appreciate that, and glad to know that there's definitely some resilience, even for folks that might be our senior citizens, and for those, of course, with PD. So kind of along those same lines, I'm going to turn it over to Dr. Braitsch. Or Dr. Mike, I'm going to call you. So Dr. Mike, can you talk a little bit about the long-term effects? So as we're talking about people who've had COVID with PD, when they're coming to see you as their physical therapist, what are some things that you're noticing that people are dealing with physically that they should maybe be aware of, or what are some of the challenges that you see as a physical therapist?
Well, it seems like whether someone has Parkinson's disease or not, there can be long-term effects from having COVID-19. Also, though, we know that just like Lauren and Dr. Chitnis said, it's variable. The way it impacts people is highly variable. So I've met people who don't have Parkinson's disease, for example, who have had long-term experiences of fatigue, headache, muscle weakness. And the folks that I've seen so far that have Parkinson's disease, who also happened to have contracted coronavirus, fortunately, the ones I've met and worked with have fared generally pretty well, thank goodness. But that being said, a couple of them, really, it took a lot longer than they would have expected to get their energy levels back. Or like Dr. Chitnis mentioned, the role of cytokines and systemic inflammation being a major factor with COVID-19, especially in severe cases. It seems like anywhere where somebody already felt chronic pain, they tend to feel flared up by having COVID-19 as well. Again, that's just my observation so far, but some folks that I see in therapy, maybe we're working on their walking, but they also have back pain, and they might say, wow, my energy level is low, just like when I'm in an off period from my Parkinson meds. But also it seems like since I got coronavirus, COVID-19, my back pain is much worse. And then we've got to do a little bit more to try to figure out how to get them to better participate in therapy. Again, kind of like Parkinson's, it's really variable, but the risk of long-term drawbacks and lingering side effects is certainly there, and it certainly can be a very serious issue too. I know there's some folks in reports from Italy who were developing Guillain-Barré syndrome and other serious negative side effects too. So we're learning more all the time about this thing.
You're absolutely right. And again, it just goes to show that the symptoms and the experiences are so vast, as you said, with or without Parkinson's. So thank you for that. So Dr. Chitnis, our next question is for you. Can you talk about why the loss of smell is one of the early signs of COVID-19? And is there any correlation with the loss of smell and PD with COVID-19? Seems coincidental, maybe not. Can you talk to that, or is there any research or studies that explain that?
Yes, certainly. And they actually, interestingly enough, was a paper, when I was trying to do some research when I got your question. So really, the honest truth is that the pathophysiology of developing hypoosmia or olfactory dysfunction, reduced sense of smell, in patients with COVID is really not really known. It's quite unknown. But at the same time, the nasal cavity certainly can be a portal of entry for a lot of the viruses or bacteria, and so they can either be damaged to the olfactory epithelium from the entry itself, or they think that you could even have some central olfactory processing pathways that could be affected basically by the virus. So really, is it viral induced olfactory nerve damage or some kind of inflammation? That is the cause, is definitely one of these speculations for COVID. For Parkinson's, you know that the olfactory epithelium has dopamine containing neurons already. So in Parkinson's disease, we're slowly losing all the nerve cells that make dopamine, so including the olfactory bulb, and therefore patients with Parkinson's disease end up developing hypoosmia. I think if the mechanism for the virus could be believed that it was destruction of the nerve cells, it's in Parkinson's disease, it's more of a degeneration and loss of the neurons that make dopamine. So there might be some pathophysiological commonality per se, but there is, Parkinson's disease is neurodegeneration. The virus is not neurodegeneration. The virus is purely inflammation, infection.
So as we hear through a lot of people who have had COVID, they might lose their sense of smell, but it generally seems to come back. Although, as Dr. Mike said, it might be a week later, or it might be several weeks later. Again, it's variable.
Yes, that's correct. So, patients with Parkinson's disease will have had loss of smell for 10 or 20 years, even prior to the onset of their first motor symptom. And they don't always realize it, or they don't always realize the significance of it. But now that more and more that we know that there is this really prodromal, preclinical and pre-symptomatic phase of Parkinson's disease where people can have hypoosmia, they can have depression, sleep disorders. So I think that this is neurodegeneration in Parkinson's, but I think that the virus is basically just inflammation. And I think the ability to smell again may return certainly in COVID-19 patients.
Makes sense. Lauren, switching over to you, can you talk about some of the specific side effects of the vaccines that people with PD might experience after their second shot? I know a couple of folks I see here that I think just received their second shot. And as we mentioned, a lot of folks have already received their first one. But what about for that second, their final vaccine? Any specific side effects people should be on the lookout for?
No, that's a good question. And just like the COVID-19 infection itself, everyone responds to the vaccine very differently. So you may not have noticed anything, but common side effects are pain around the injection site, some fatigue or headache, a mild low-grade fever, or just feeling muscle aches, kind of a typical vaccine reaction. And that's because your immune system is being activated and doing what it's supposed to do to learn what the virus looks like and be able to combat it if you come across it after you get the vaccine. So those side effects seem to be much more prominent after the second dose, because that's the larger amount and you've already had some immune response. So those are much more likely to occur, or they may occur a little bit more moderate, or may last a few days longer than it did after the first dose. There shouldn't be anything specific to Parkinson's that it makes you more likely to have a certain side effect. It's the same for anyone that has it. I haven't seen any reports having any issues with the vaccine as it relates to Parkinson's itself. So just monitoring for those kind of normal vaccine reactions and letting the primary care doctor know if anything is out of the ordinary or severe, using over-the-counter Tylenol or Advil if it's safe to do so, to help with the muscle aches or the low-grade fever. But hopefully after that, there should be that should all resolve.
Very, very encouraging, and always just good to hear that sometimes side effects are going to be a part of it and could last. Again, it could vary whether that's a day or into 2 days. So
I think it's also helpful to know that that's your body's immune system doing what it's supposed to do. So as long as it's mild and self-limiting and hopefully resolves after a few days, but after that second dose of the booster, it is more likely. So
that's good to know. So I'd like to open it up now. We've got close to 60 folks. So if you can either use the chat feature or the raise hand feature to let us know if you have a question, if you prefer to ask that, let us know, and we're happy to unmute you so that you can ask a question to one of our panelists. Or if you prefer to ask that question on using the chat feature, feel free to do that as well. I see one question here, and I think we've answered the question about the second dose being stronger than the first. And so Lauren answered that for us. So an important question, again, just to be aware. And then Mike, it looks like you've got a comment too regarding some information that you had heard. Did you want to share some of that?
Yeah, I'll be glad to. Am I unmuted?
You are.
Okay. My sister, who thinks that by virtue of working at DAPS that I'm an expert on everything, and God bless sisters, But she asked me the other day, she said, I had heard from someone that there have been people who have had COVID that have developed PD. Is there any relation to that? And have you heard anything about it? My comments to her was that I hadn't heard a thing, probably coincidence, but any of the panelists, have you heard anything, or would you speak to any insights you might have?
I don't know if Dr. Chitnis is unmuting herself there.
Go ahead, Lauren, and do you have a comment? Or I can...
Oh no, you go ahead. I was gonna let you go first.
Yeah, so that's a really good question. I will say that we are seeing a lot of COVID-related neurological symptoms. Like we're seeing presentations of Guillain-Barré syndrome, we're seeing presentations of inflammation that is encephalitis, we're seeing presentations of what's called myelitis, which is inflammation of the cord. We're seeing a combination of encephalomyelitis, which is inflammation of both the brain parenchyma as well as the spinal cord. There is involvement of the brainstem that has been shown as a neurological manifestation of COVID, people getting strokes as well. I think we're seeing myoclonus. Parkinson's is something that requires at least a certain, I mean, unless it is like the post-encephalitic, von Economos encephalitis of 1920, I don't think we are seeing anything like that. But even that, didn't manifest right away because, slowly people just, their basal ganglia got wiped out and people became Parkinsonian. So does the risk exist? I think the short answer is yes. But the long answer is, I think this year is when we will find out more. I haven't seen anybody, I didn't see a case report and I haven't seen any friends report COVID-induced Parkinsonism yet, but we'll let you know if you see anything.
Thank you.
Thank you. We do have a comment here. And this comment, I've had PD for 3 years. I'm 66 years old, tremor dominant, right hand only, and I'm beginning to see in both feet some numbness. I do not have diabetes. Could this be PD related? Lauren, would you like to take that one?
Yeah, I can. So yeah, numbness, tingling, or abnormal sensations is possibly a symptom related to Parkinson's, but it is a little bit more rare than motor symptoms, so not extremely common. So we would definitely like to make sure we rule out other causes. Diabetes is the most common cause that we think of, but there are some other things like low B12 or B vitamin deficiencies, thyroid problems, other issues that can cause that numbness and tingling. So if it's something that's prominent, especially if it's progressing, getting worse, definitely something that should be checked out and discussed with your neurologist. They can do some basic workup in labs to check that, or refer you to a different subspecialty in neurology, not movement disorders, but called neuromuscular disorder clinic. And they evaluate for the numbness and tingling just to make sure there's not anything secondary going on. Just because you have Parkinson's and have a symptom, we don't want to always blame it on that, even though we know that it's likely. If it's a simple thing to check out and just rule out other causes, that's a good idea to do. But sensory symptoms can be a part of Parkinson's disease itself, but just a good idea to check out and make sure there's not anything else going on that could be treated or needs to be treated separately.
Dr. Mike, as a physical therapist, is that something that you see or deal with at all in terms of issues with numbness or tingling in the feet? And are there some approaches that you typically take that are helpful?
Yeah, I think that numbness and tingling in the feet can certainly throw off people's sensory input for balance, and it's even more important for them to get into PT and stay on top of their PT regime and stay closely in close conversations with their physical therapist, because balance is already something to be to keep top of mind when you think about progression of Parkinson's disease. There's some success that we've had with different shoe inserts and different mats that people can stand on that have certain texturing to ramp up sensory input. Sometimes that can help. But more than anything, it just makes it more clear that someone needs to really make a top priority of working on their balance under the supervision of a licensed physical therapist, because a PT is going to be able to give you, based on how you show up and where your deficiencies or areas of opportunity are, a custom tailored program for you, as opposed to just doing a Google search or looking at some balance videos on YouTube. I mean, those aren't bad things, but why not take advantage of a PT and get some help before it becomes a big problem?
Good advice, good feedback. So a couple of the $1 million questions that everyone wants answers for. So we've got, our first question is, now that there's a vaccine, do you believe that we'll be able to stop wearing masks within the next year or so? And when is your best guess as to when it will be safe for us to begin traveling, attending sporting events, etc.? And I'll start off with Dr. Chitnis.
Yeah, thank you, Lisha. I'm per se a very conservative person. I was one of the first people to get the vaccine. I don't believe I'm going to lose my mask all of 2021. I think there's two ways of looking at it. One is, protecting yourself by wearing the mask so that, you don't get the infection. But the second thing is, infecting somebody else. So there is, two ways of looking at it. So I think I need to wear a mask and everybody else needs to wear a mask so that, the chance of me developing a severe COVID infection is relatively low because I have been, immunized. But remember that there are variants of, the mutants of COVID that are also coming out. So, does the current COVID-19 vaccine provide the same level of immunity for the mutants? We don't know the answer to that. I believe that they are trying to study that, but I could be a carrier of the virus and I could infect somebody else by not wearing the mask. So my humble opinion is that, until we officially hear from like CDC, some good data, that I think we need to continue to, in spite of having been vaccinated, continue to wear the mask, continue to wash your hands, continue to practice, social distancing and not have, big parties and things like that. I mean, if you notice that right after Thanksgiving or after Christmas, the number of new cases of COVID suddenly went up because people just were getting together. So, I think it's a bad idea. We've survived a whole year. I think we're strong. Hopefully we build enough resilience. I think we can survive another year.
Mm-hmm. Thank you for reinforcing a lot of that information that I know we've heard, but hearing it for you, I think puts it in perspective for all of us, for sure. Another question we've got is, what are the best ways to improve posture? We are all using the computers and our screens all the time, so we know that we're so much more sedentary than we want to be. But as you mentioned, this is probably still a reality of our future, for the near future. So how can we improve our posture? What types of, what should we be cognizant of? What types of exercises, direction? Dr. Mike, I'll turn that one over to you.
Yeah, thanks. That's the kind of thing I love to talk about. So, for spending time at a desk, let's imagine you didn't have a progressive disorder like Parkinson's disease that will attack postural control. If you were just an office worker, let's say, you're still at risk of problems that are secondary to or a downstream problem that stems from this hunched over forward posture. Or I don't know if any of you watched this, but I grew up watching The Simpsons. And so I always call it the Mr. Burns posture because he was the guy on there who was just always hunched over. So I think no matter how far gone your posture is, or if you don't have any postural problems, but you're just spending more time at a desk or you just want to get ahead of it, it's never too late to take positive action. It's also never too early. And the general rules would be muscles on the front side of the body, you can really work to stretch them. So for example, in the chest, stretching in particular pec minor. And you could do that if my screen here was the frame of a doorway. You could keep your elbows below shoulder height, take a big step into that doorway and lean into it. You don't have to go crazy hard. Keep your head up and back up, and that helps to stretch out those pec muscles. I find a lot of folks that I see in therapy are doing a lot of the right stretches. They just don't hold them long enough. And the magic number from research tends to be 90 seconds of time under tension, which can feel like an eternity. So you could either do a 90-second hold or 3 rounds of 30 seconds. That would be good. So if you stretch muscles on the front of the body, think pecs, hip flexors, and if you strengthen muscles on the back of the body, so between the shoulder blades, you could do some movements where you just push your chest forward and squeeze your shoulder blades back and down. Or you could take the back of your palms and try to reach back against a wall. There are all kinds of ways to do it, but the general idea is to activate those muscles between your shoulder blades, squeezing back and down. That can help open up the chest. Strengthening muscles on the back of your body like your glutes at the hip level, your calves to keep your walking really good. these can all help you to be much more upright. And I know a lot of people don't want to do that stuff on their own. So there are great ways to do it with things like Pilates or yoga or Tai Chi that have all been really well researched. In fact, there's a lot of research on Tai Chi, which I'm obviously very biased towards. I've done it for a long time. But no matter how you get after it, if you use those themes, it can be very helpful.
Great feedback. Yeah, I think that's really helpful. I think everyone can relate to that for sure. So we're going to switch gears just a little bit since we've talked about some of the physical aspects, some of the issues that are related, of course, to PD, the vaccine, and COVID. Now we're going to kind of switch gears to some of the cognitive issues that folks with PD often face, but especially, and this is really kind of for the general public as well, during the pandemic, as we are all faced with such extreme isolation that we are all at a high risk for. So Lauren, I'd like to start with you. Can you talk about any type of cognitive exercises or habits that can help us to stay sharp when we just don't feel like doing anything or getting on another Zoom call? What are some of your thoughts and recommendations?
So cognition and memory are obviously very, very complex things, but your brain is like any other muscle. So if you don't use it, you'll lose it, kind of thing. So it requires some exercise, so to speak. But actually, physical exercise has been shown to be very helpful for mental cognition. So exercising, moving every single day, those things can really help with that and kind of kills two birds with one stone. Eating healthy and getting good rest at night, all those things are important. Sometimes we put too much stress on the system and expect things to feel normal or sharp or not fatigued, and maybe just putting too much stress on our system by not sleeping well or not eating processed foods and not exercising. So those things are basic things are really important anytime, but especially during a pandemic and being stuck inside, that can be helpful for that. Creating routines and schedules, your brain really likes those and responds well to that. It helps keep things organized. So those things are really helpful. And staying socially engaged is really important for cognition as well. So social conversations and interactions really challenge your cognition and your brain, and work as an exercise or workout program for it. There are some good programs out there, brain games or things online, word searches, or just those types of games that help challenge your memory and cognition, which can be helpful for some patients. Some of them are better than others, or some people may not enjoy doing them, and that kind of defeating the purpose. So you don't have to do those, or if you don't enjoy it, you should try to find something else different to do. But I think the bigger things are, staying socially connected, exercising, and those other things as well to help improve cognition with or without Parkinson's disease.
Great, thank you. That's really helpful. And I know for all of us, we've all done millions of puzzles, or we've watched so many YouTube videos. We're kind of blue in the face, and so I think you're right. We're kind of at a point now. I know for me, I've tried to take up a new hobby, so I'm trying to learn calligraphy, which is random. But I just thought, I don't know how much longer I have of this, so I've got to start doing something new because I've binge watched every single show that I can possibly binge watch. I've listened to every audiobook out there. I've read every book. So at some point it goes back to kind of what you said, creating maybe a different routine, but something that is still mentally stimulating is challenging. And sometimes I think we just don't want to. So that kind of leads me to my next question for Dr. Chitnis regarding depression. And again, I acknowledge that I think this is something that all of us are prone to under the current, circumstances. But when it comes to PD and depression, what should people be looking for, and who and how should you begin this conversation with? For some folks, it might be their partner, or a good friend, or maybe a doctor. But can you talk a little bit about how to begin that conversation and what symptoms to look for? Can you unmute your mic, Dr. Chitnis? No problem.
Such a knee-jerk reaction to mute. I'm going to say that, depression and Parkinson's disease by itself, I'm going to keep COVID out of it at this point, is really multifactorial. I think mostly depression is biological. It's because of, so dopamine is not the only neurochemical that is, that is reduced in patients with Parkinson's disease. There's other chemicals such as serotonin, there is, norepinephrine, acetylcholine. All of these are also, because of the degeneration of the multiple neuronal systems, that you tend to lose a lot of these things. And so depression is a very considered to be a clinical, pre-biomarker for patients with Parkinson's. Somebody may have no family history of depression, no family history of depression whatsoever. They may have, no personal history at all, and suddenly, they end up having these symptoms of depression and then follow along with it. The second kind of depression is reactionary to having had a new diagnosis of a chronic neurodegenerative disorder. And people hear the word Parkinson's and they think their life is over, and that's absolutely not true. But it's all about, and that's why I think these educational programs are so important, because we're able to dispel some of the myths that go along with Parkinson's. So, but reactionary depression is quite common. How do you recognize depression in these people? I promise you, most of my patients will not come out and tell me I'm depressed. It is up to either the spouse. So some of the things that the spouse may notice is, just my husband's just quieter. It's just not talking to as much. It's just lost engagement. Like he loved playing golf on Sunday morning with his buddies, and he just doesn't want to do that anymore. Like, at night, he would take out the trash, and that was part of his job, and he just like kind of not doing it anymore, right? Activities that, the person really enjoyed, they kind of stopped doing that. We think about depression and we imagine somebody that is sad, that's morose, that's crying, but it's not true. That's one phase of depression. But I think there are so many different, phases to how depression presents to it. So in some people, it might be, I just stopped eating. I know for myself, I haven't had depression, but I've gone through Hurricane Katrina. I've gone through personal illness. Anytime that I'm challenged, I know what happens to me is I cope very well, but I end up gaining weight, So it tells me that, I'm looking for some kind of a, safe place for me to feel better, right? So I think that there is that weight gain and weight loss, kind of like a component to eat as well. Sleep issues. Either people sleep too much during the daytime, or they may not be able to sleep during the nighttime. So that's a problem. Losing motivation, apathy, I know is a separate issue. Just being irritable. Anxiety is a comorbid illness with depression. So those are all the things. But the people who can pick this up is a spouse, a therapist, if there's a speech therapist, a physical therapist, a friend. For me, if I've seen my patients for so many years and I know their personalities pretty well, I think I can pick it up pretty well as well. I'll say, hey, what's up? You're not talking to me today. You're not, you're not smiling at me, right? So those kinds of things. But I think that we need to be actively engaged in asking these questions of our patients. There's actually, a Parkinson's disease, like a yearly check-in that we do. And these are symptoms we really need to ask about. We focus a lot on motor symptoms, but as a movement disorder specialist, and myself and Lauren, we really focus on non-motor symptoms as well, and depression being a major non-motor symptom. And I will tell you that the quality of life of patients with Parkinson's disease, in spite of medication, in spite of great DBS, is impaired because of non-motor symptoms, depression, psychosis, anxiety. And these are the things that will get patients in nursing homes, so we really need to identify those. Now, as a psychiatrist, I think a referral to psychiatrist is justified. I'm not a psychiatrist. My patients expect me to be a primary care doctor and a neurologist and a psychiatrist and a COVID doctor as well. But, I need to recognize that I only have expertise in certain areas. So I will send them to a psychiatrist for an initial evaluation. If the psychiatrist says they don't need medication, they just need to maybe exercise more, they need to kind of, spouse needs to help them engage more. Maybe they need to go to counseling and talk to, a non-judgmental person who doesn't know them very well. Because, the doctor, the spouse, the family, the patient perceives that as though they're judgmental because, they know me. So if you go to a counselor who doesn't know anything about you and you're able to just, I call it like shoot off steam and just say the things that you really want to say. And, they have good coping tricks. Cognitive behavioral therapy is all about providing these, tools and tips and coping skills. I think exercise is a major one. People really need to just exercise. Is the best antidepressant. Did I answer all your questions?
You absolutely did, thoroughly. Thank you. And I like that you didn't just say there's just one medication out there and that's going to fix it all, because it's not that simple, and it's just not that clear cut. But I like that you gave people some tools that they can absolutely consider when they're feeling that way, instead of feeling like, oh gosh, I'm going to be thrown into a hospital and now I've got to go see a psychiatrist. That's not at all what you're saying has to happen. That this is really more about assessing where you are, and there are some tools that we can use on our own to determine if that's helpful, and if not, then there's always more help that's available as well.
And I just want to add one last thing. Everybody with Parkinson's needs to recognize that they're very special, but they're not so special. Everybody can get depression. People, I can also get depression. I could get diagnosed with something bad, or somebody close to you could die. And I think that depression is something that we are all prone to. What everybody needs to recognize is depression can be treated. Okay, this is something, I as a physician look for treatable things. My goal is to find every single thing that I can treat. And so I think depression is very treatable. We just need to get our people to engage. But we need to realize that one of the problems is the lack of motivation and lack of engagement also entails lack of wanting to see a doctor. So I think that the family, without nagging, really needs to be supportive and say, I just need you to be my husband again. I just need you to be the person that I love, and I need you to go take good care of yourself. There is no shame.
Absolutely. Well said, well covered. And that's a great transition over to Dr. Mike. So we'd like to talk a little bit about exactly what Dr. Chitnis said, apathy. And I'm sure that you see that a lot for folks that are coming into you for the 6th or 7th week, and they're not real excited to be there. Can you talk a little bit about apathy, how we find that intention or purpose daily when we're under these circumstances, when it's really challenging to do so?
Sure. Well, I got to tell you, first of all, too, it's tough to differentiate apathy from depression. And that at times I feel like is far beyond my skill set as a physical therapist. But I can tell you this. First of all, to a point Dr. Chitnis made moments ago, I think something would be wrong if you were going through a global pandemic and a tumultuous time like we all have all over the world over the last year, and you don't feel like you're a little bit down and out sometimes, or a little bit off. And that's okay. That's a sign that you care about your life and you care about your place in the world. Where it can be debilitating, though, is how much time you spend focusing on that, if that makes sense. So I'll give you an example. Especially in physical therapy and in my group programs, I've met people who are just not at all interested in exercising in any way, shape, or form. And that to me screams apathy. It could be other things, but it often looks like apathy. What I find, though, is if people can just, for lack of a better term, fake it till you make it, and just suit up and show up for a workout anyway, or in these virtual times, if you can just build it into your schedule anyway, and you can say to yourself something like, I don't even need to give this my best effort ever, because there are days where things are up and down, but I do need to show up and try. I don't even have to go for a record-setting performance, but I just need to show up and try. I will say, I've seen quite a few folks with Parkinson's disease with things that look like apathy or depression who have seen some pretty big improvements after even just a few weeks of consistently participating in exercise. That's not to say exercise will rid you entirely of depression. To Dr. Chitnis's point, there is a big place in this world for psychiatry, for counseling. These are necessary things. some would argue for everyone, not just for people with neurological disorders or altered brain chemistry. But I will say, in terms of the exercise component of it, we know that Parkinson's disease is like the poster child for the mind and body connection. And so we know if you're feeling additional stress, whether it's mental or, like we talked about earlier with infection and inflammation, if it's physical stress, either of those can really cause a short-term flare-up of symptoms, where people tend to experience their symptoms more severely than they otherwise would, even on the same amount of medicine and all of that. At the same time, exercise can be a profound stress reliever, as can other mind-body practices. So, I feel very fortunate in that I get to teach Tai Chi, among other things, because that helps with the deep meditative aspect of it and the deep belly breathing we use. If nothing else, that your mind's wandering when you're doing Tai Chi because you feel like, oh, I wasn't performing that technique right at all anymore. And you can come back to the present moment. For our groups, I've also, and I've been doing this too this year, but I've also been encouraging people to try out things like meditation. And there are great free apps and programs. You can get guided meditations, even on YouTube, just something to calm the mind or quiet the mind. I've also encouraged folks to try to find ways to check on other people, because like Dr. Chitnis mentioned, we're all going through this. And that's one thing I've taken some comfort in, is that this isn't happening to me. This is happening to all of us. And I feel like the folks who end up feeling the best or get pulled out of it, out of a funk when they're in one, they get pulled out by checking on other people and broadening their perspective of the world. So I'm fortunate. I got a lot of people I can call to see how they're doing, and that'll get me out of my head. But another practice too that seems to help people just feel a little bit better about the world that they're in and their place in it, which again is not physical therapy, but is just a widely used practice around the world, which is just practicing gratitude. And that can start with as simple as, I am alive. And for me, I get into a habit of listing things that I'm grateful for. And when I'm in the worst mood or in the worst place, that's the last thing I want to do. But just like exercise, if I can just show up and do it anyway, things get a lot better. And for me, at least, I know that I'm able to see a lot more things to be grateful for. And it just kind of builds on itself. It's kind of like what Lauren mentioned with the mind. If we exercise certain aspects of it, we can try to preserve or improve those areas of function. I think the same applies with gratitude. So that sounds a little out there and a little woo-woo, but if you're in a bad place, you might be willing to try some things you normally wouldn't. So that's a lot for me. I'll shut up now.
No, those are great answers and just really important. You hit on so many important issues. And of course, gratitude, regardless what our background is, gratitude is I think very, very important for all of us, however we might express that. So thank you for those important reminders. And the fake it till you make it. I could not agree with you more. I think, at this stage in the pandemic, and especially when I know for me, I feel antsy as the vaccine is rolling out and more people are getting it. There's that sense of, okay, I'm ready to go. Let's return to normal. And I think what you said about fake it till you make it, we've got to still stick with some of our core routines and making sure that we're still doing our exercise, whether that's switching from the bike to Tai Chi or a yoga video. There's so many options out there, and it is hard to do that sometimes. And you're right. How well we do one day might not be how well we do the next day. That's okay. That's part of it. So you hit on so many important points, and I'm really, really glad that you shared all those so much. So let me open it up. We are kind of coming to a close here, so I want to be aware of everyone's time here. Dr. Chitnis, so glad that you shared gratitude and spirituality along with exercise and engagement with people in our lives has really helped. Could not agree more. I am 100% on board with you there. So we'd like to open it up to our audience, to our attendees. We've got such a terrific participation today. So again, whether that's through raise hand or if you want to use the chat feature to ask a question or a comment. I've got one comment that came through, and this is specifically related to exercise. So Dr. Mike, this might be you. The question was around exercise and duration versus intensity. Are both equally important, or is one more important than the other? If we do a light walk for 30 minutes 3 times a day, will that cover it, or do we need to pick up the pace?
Well, I think more than anything, consistency and safety are the 2 primary pillars of a good exercise routine. There's more and more research coming out about the role of intensity in terms of giving you the best possibility to slow the progression of symptoms or improve or facilitate motor learning, meaning, the more you do something, the easier it is to do it. If you've done some intensive aerobic exercise in particular, your brain becomes more excitable and it becomes easier to strengthen those connections within the brain. But that has a basic prerequisite that you can participate in that activity safely. I say that because prior to physical therapy, Mike mentioned I used to do a lot of martial arts and competition and fighting. I knew some people who were doing some pretty crazy stuff training, and I learned some key lessons there. If you jump in all out in terms of effort and intensity, you're probably going to have some negative fallout from that. So there is value to gradually ramping up intensity. And I'll say this too, a lot of the research that's out there for exercise, in particular as it relates to Parkinson's disease, says the difference between intensity for exercise, if you think about 0 out of 10 is like you just woke up from a nap, your resting level of intensity, and 10 out of 10 is your max. A lot of the research out there says in an ideal world, you'd probably get to during a workout somewhere between a 4 out of 10 in terms of intensity and a 7 or 8 out of 10. So you can overdo. That's one thing to keep in mind. The other thing though is with consistency, over time, you're able to do more and more before you reach that 4 out of 10 level. And you're able to accomplish more before you hit that higher end level because of the way your body adapts to exercise. That usually takes 8 to 12 weeks of a consistent workout routine before those changes take place. So I'd say if you're doing something new, talk with your doctor. If you're thinking about doing something new, talk to a physical therapist. And that way you can come up with a custom tailored plan for you. The good news too is in the current world we're in, although we've got this pandemic, we've also got a lot of resources that weren't available even a few years ago. For example, some of the folks on this meeting today might have wanted to go to wherever ADAPT's meeting was being held, but might have had to coordinate transportation. Instead, you can do it from your home. That's great. You can do the same thing with exercise. That's great. But the trick is just to make sure you're not taking on too much too fast and that you're doing it safely. The last thing I'll say is we know that every kind of exercise helps. There's a cumulative effect. So some days if you feel like, man, I'm not giving it what I should, don't worry, just keep going. And if you can get to a period where you're doing at least 75 minutes a week of intensive exercise and 150 total minutes to 300 total minutes of exercise each week, that is wonderful. That would be a perfect place to be in.
If I can just add to that, from a personal perspective. So, I've always been very athletic since I was young, but, then, you go to school and then you get married and then you have kids and you have a busy job and then, some life crap, pardon my French, happens and you kind of fall off the curve for exercising, right? This is true for all of us. I will say one thing that the pandemic really brought to my attention is we really have to charity begins at home. We have to take care of ourselves first. I've always, just being a woman, being an Indian woman, seen my aunt who's actually on this call And my mom, big shout out to her. She's been a major influence on my life, and she's part of the reason why I am where I am. And seeing how self-sacrificing all the women have been, you know, I've kind of ended up being that way. But, you know, I'm my best resource. If I don't take care of myself, everybody that's connected to me falls apart. And so that's true for all of us, right? So I think it really means being present in the moment, doing everything. Like, you know, if you're eating, look at what you're eating. Like, should I be eating this, right? I mean, you know, some days you say, I'm going to eat this because it makes me feel good. And if that's an entire chocolate bar, so be it. But don't do it every day, right? Do it every so often. But, you know, exercise. Like, there is no reason why we cannot exercise every day. Like, you know, you don't have to do high intensity every day. You walk one day, you bike one day, you work with Mike one day, you do the elliptical one day, you know, you walk the dog one day if it's not very cold. You know, you just do a lot of chopping and cutting and cleaning in the kitchen, and that's exercise, right? And it also releases endorphins, and it really makes you feel better. The first week or two, you're gonna feel super crappy. You're gonna never get out of the bed sheet, right, Mike? But then week 3 or 4, you're gonna be like me. You know, I do a full day clinic, I come home, I cook, and I'm so energized to still want to exercise. But this took me 9 months of pandemic to get here. So everybody can do it, right?
That is such a good point. You're right. Sometimes it just takes us some time to get there. So very relatable, I think, for all of us. So thank you so much for those comments. Mike, I'm going to turn the floor over to you and let you close out our session today.
All right. I hope that everybody will stay with us for just a few minutes. I promise I will be short. And I don't know if I can create a new trend here today, but I'm sure going to give it a try. We're not going to give standing ovations, but I want to give this to our facilitator, Leisha, and I hope the rest of you will join me. She has done a fantastic job. And so thumbs up to Leisha. And then to our presenters, Dr. Chitnis, Dr. Braitsch, and Lauren, thumbs up, and great job, guys. And then finally, let me close with this. I don't know if anyone else is guilty of this, but there have been lots of times that I've been sitting out in the pew listening to the preacher, and in the back of my mind, I'm saying, I know somebody that needs to hear this. Well, I've had that same feeling today. I know some people that I wished had been here to hear this. We've recorded it. So keep your eye on our social media, keep your eye on our website. And if you, like me, have been thinking, I know someone that needed this, then there's going to be an opportunity for them to see it. We have had close to, and maybe 1 or 2 times over, 60 people join us today. Great group. Good to see so many of you again. Blessings, stay safe, and thanks for joining us today.